All right, so I wanted to talk about this recent case we had. So this is a patient who traveled from out of state. She had previous fibroid surgery, which was complicated by really excessive bleeding, to a point where they had to stop the procedure and were not able to remove one of the deeper fibroids. So over time, that fibroid grew and it became a very, very large fibroid. And when she went back to either that surgeon or other surgeons in the area, they told her there's no way they're going to attempt to do the surgery because of that prior surgery being so complicated. She ended up coming to our clinic where she successfully had her fibroid removal surgery in an outpatient facility. And, of course, it was not an easy surgery because if it was easy, then, she could have had it done somewhere else. But we completed the surgery. We were able to use certain techniques to decrease the bleeding, but also because of the location of the fibroid and because it was so vascular and because of the bleeding, we used, for example, a cell saver, which is a piece of equipment that we can take the blood and reprocess it and give it back to the patient through the IV and avoid having to have a blood transfusion, which is what she had to do with her previous surgery. So a combination of techniques and resources, allowed us to get the surgery completed, and the surgery was successful. We saw her in the office the next day. So she went home, she stayed in a hotel, came in the office the next day, and she was feeling great. No sign of low blood count. She was walking around. So really a successful surgery with a very difficult large fibroid and a difficult location of the fibroid.